Hey everybody, Dr. Dale here. Going into surgery today, so I just want to ask all the patients and anybody else there watching this for prayers. I know I'm going to pull through fine. I have complete faith in God watching over me. I also have faith, and I believe that the doctors are excellent doctors, going to be able to go and sew up this hand. If you haven't heard and don't know, I fell over the holiday weekend snowboarding. Was trying out for the 2014 Winter X Games and Olympics, and I was doing this inverted 900 triple axle spin, and no, I really wasn't. I was simply trying to goof around on the slopes, but fell on it, crushed the end of my thumb, several pieces there, so I have to have reconstructive surgery because of the type of break that I had there. So, and if you know me, I eliminate drugs from my life. I try not to take any drug. I don't take any drugs. I don't do any surgeries. But in this situation, I thank God for our emergency care system that we have in America. We're very good at patching people up in accidents and injuries like this. We're just not very good at keeping people healthy. So, that's my role. That's what I love to do. But I just want to kind of just give people out there, maybe if you're going to have a surgery in the near future because of an accident or something like that, and you need increased healing during that time, I want to give you some tips here. So, and just let you know what I'm going to be doing. Well, I'm going to go into the surgery. The only thing I'm going to let them do is do an interscalene block, where they're going to do basically like having a pregnant mother or a mom who's giving birth. They would have the lumbar puncture, an epidural, and they would numb everything from the waist down. Well, they'll go in here, they'll find the nerve root with a big needle. Typically they use an electrical device to actually shock your hand to make sure it's in the right nerve root. And then they numb that nerve root, so they're numbing just that area of the hand and paralyzing it so I can't move it during the surgery while they're doing surgery. So they'll go and repair it. I'm not going to take any pain medications. I'm not going to let them put me to sleep. I don't want any of those toxic chemicals in my body. But I will be taking the stuff that they inject in my body. I'm going to be taking my daily detox a little bit extra. I'm going to take that right here before I go, take the cell detox, and then I'm going to take immediately after the activated carbon and charcoal in there to soak up and eliminate as much of that toxicity as I can possibly. I'm not going to take any pain medications, because pain medications, specifically anti-inflammatory pain medications, can lower our body's ability to heal soft tissue. It actually inhibits soft tissue. So if you're taking a pain medication out there for back pain, neck pain, or any pain, you're inhibiting your body's ability to heal that area of the body. So I wouldn't recommend it. So I don't want it to be I don't want my body inhibited to be able to heal this properly. So I'm going to let God heal it at 100%. Yeah, the pain will probably suck, but when it comes down to it, you know what? Mind over matter. This pain is not a life-threatening pain, so I don't feel it is a necessity to take a pain medication. That's me personally. You make the decisions about that in the future yourself. Now, I will be taking things like the Max Recovery Formula. The Max Recovery Formula has proteolytic enzymes in it that lower inflammation and actually can lower a little bit of pain, so I'll be taking those, but they're going to help with tissue healing and tissue repair. Then I'm going to be taking, again, like my daily detox to eliminate any of the chemicals they have to inject in to numb this and paralyze it so they can do the surgery properly. Then I'm also going to be increasing my vitamin C, increasing my vitamin D obviously for bone absorption, vitamin C and vitamin D for my immune system, to be cutting it open, opening it up to the atmosphere. So I want to be able to have my immune system functioning properly. I've been getting adjusted more often here lately. I need my brain to be able to communicate to my hand and my whole body to function properly and heal properly. So that's things I've been doing. I haven't taken a single pain medication. Again, I think I've already repeated that several times. Feel very strongly about that. I'm going to be juicing vegetables, specifically things like bok choy, kale, collard greens, certain things like that. I'm not eating any grains. I'm not allowing sugars into my body. I'm going to eliminate a lot of that stuff so that my body can heal better. Really focusing on nutrient-dense foods right now to give my body all the raw materials I need to heal this hand as quick as possible. And anybody watching this, don't think that you got to give me time to heal. I'll be back in the office adjusting Wednesday morning. I've been adjusting. I adjusted yesterday, Monday, with one hand. We got to modify the way we adjust. So you're face down, adjusting one side of your neck, and when you need to adjust the other side of your neck, you flip over, and we can adjust both sides that way with the left hand. It's a technique they taught us in school, and I thank God they did, because that way this one hand can still turn the power on to your body and your nervous system, allow your body to heal at 100%. Trust me, I'm not going to let this slow me down from taking care of my patients and people out there. Hopefully it will actually help us learn from something, and we all can benefit from it. We could all benefit from somebody else's mistake, mine in particular, mistake on the ice and on the snow. But so just be praying for me. I'll heal up quickly, I promise you that. Today, Tuesday, January 10th, there's a Dr. Mark from Dr. Ben Fallis' office, another Maximize Living doctor. He'll be up adjusting the day, filling in. Again, I'll be back in Wednesday morning, normal hours from then on out. So make sure you're in here getting your adjustments. No excuses why for me not being here, other than the time that the doctor had to schedule my surgery. So no excuses for yourselves out there. Get in, get your adjustments, get your power turned on. Say a prayer for me again. And then I want to update everybody, make sure people know about our makeover on January 19th. Our makeover is going to be focused on weight loss. I'm preparing a great PowerPoint and great bit of information for that. We're going to be focusing on weight loss. And even if you don't want to lose weight loss, when it comes down to it, I teach people how to get healthy, and then the weight drops off. So if you just want to get healthy, come to the workshop and the makeover anyways. And when I say weight loss, just say health, because you're getting healthy to lose the weight. You're not going to be losing weight to get healthy, doing it the wrong way. So that's even more reason to be there. Also, I want to invite you to bring your family, bring your friends to that workshop. It's 2 hours, January 19th at 6 p.m. So thank you everybody for being supportive through this process when I'm injured and a lame duck or whatever you want to call it. But I'll be healed up very quickly. Again, nothing's going to slow us down. It's that max mind, and I hope that everybody else can learn from this and have a max mind and maximize their life as well. So God bless everybody. Be praying for me for the doctor to have very specific hands and tools to be able to go in, sew this up, and it heal at 100%. So thanks everybody. God bless.